Hello, welcome everyone. In the last video, I already told you about bacterial vaginosis, which is mainly caused by anaerobic bacteria, that is Gardnerella genus. And I told you about the symptoms, why bacterial vaginosis occur in the female vagina, and what are the diagnostic tests, and what are the treatment, and what are the sides effective due to these treatment. This was all which I already told you. So in this video I'm going to share another topic, that is a Trich infection, which is another vaginal disease. So basically, Trich infection, the causing organism for the Trich infection is the Trichomonas vaginalis, which is a one cell, that is a single cellular organism. And this disease was firstly discovered in 1836 in France, and it is due to vaginitis, and it is a sexually transmitted infection. Firstly, I'll tell you about the organism's feature, that is which type of this organism is. This is the organism which have like you can say the shape of this organism is like WBC. It is slightly larger than WBC in size, and it have whip-like flagella on its edges. So this is the shape and size of this organism, which is a single cell organism. As you already know about the like protozoan kingdom, protozoan phylum, you must like we can say that you already know about all the features of an organism which is kept inside the protozoan kingdom. So this is basically a protozoa, and this is the features which related to this organism. And how we can say how this Trich infection occurs in our body in vagina. So basically, this organism, that is a single celled protozoa, it causes vigorous movement inside the female vagina. And what happens due to this vigorous movement of this organism in the vagina? Due to this vigorous movement, it damages RBCs of the vagina, which causes red appearance of the vagina. So basically, it is the main mechanism by which this protozoa infect vagina. So what are the symptoms? As you already know that because it is a vaginal disease, so there is a mainly difference in vaginal discharge. So in the first symptom include vaginal discharge, smell like scent, causing itching also. Means due to this protozoa, the vaginal discharge smells like a scent, and due to this disease, itching also occurs in the vaginal area, and mild discomfort or pain during sexual intercourse, and even the period time extend. Means the menstrual cycle, which takes normally 3 to 5 days, it also extended 3 to 21 days. And there is a classic discharge associated with the trichomonas is green, frothy, and foul smelling. So this is all about the symptoms related to Trich infection. It can be Trich infection, you can say. Depends upon the pronunciation, which is very area to area. So it can be Trich infection or Trich infection. So now what is the mechanism basically behind this procedure? So Trichomonas vaginalis, which is a protozoa, it lives in the oxygen free medium, and wide pH range means the range is 3.5 to 8. So this Trichomonas vaginalis generate H2O2. As I told you that Trichomonas vaginalis lives in anaerobic condition, means this protozoa will grow in that condition where there is no oxygen, or there is a very less oxygen amount. But in the vagina there is oxygen. So what happens during the flourishing of this organism? Trichomonas vaginalis generate H2, and this H2 combined with oxygen of vagina. That is, in the vagina there is oxygenic environment, but this Trichomonas generate H2O2, and this H2O2 generate H2, and this H2 combined with oxygen of vagina, that is, it makes H2O2, which is hydrogen peroxide. And now due to this combination, there is we can say there is a lack of oxygen in the vagina, and the vaginal conditions become anaerobic in nature, and it leads to the flourishing of this Trichomonas vaginalis. So it is a basic mechanism behind the Trich infection. And what is the unique feature of this organism, that it can live up to 1 year in the vagina. And what are the diagnostic treatment for this organism? We can firstly do pH measurement. Whiff test can also be do for the diagnostic test, and vapor prep test is also another test which is done for the diagnosis of this disease. And we can test for gonorrhea, chlamydia, herpes, hepatitis. All these are sexually transmitted infections. And like hepatitis B and C. So this is already known diagnostic test which is done during Trich infection. And what are the treatment? You can say there are different type of different type of medicines like metronidazole, clotrimazole, nonoxynol 9, which is a spermicide. So all these are the treatment or medicines or the drugs which is applied during Trich infection. In the diagram you can see this is the Trichomonas vaginalis organism or protozoa, which is a single celled and have whip like flagella on its edges. So it was all about the Trich infection. Now move towards the next slide. So this is another disease, that is the estrogen loss vaginitis, that is atrophic vaginitis. And mainly it is due to menopause, because after the menopause in the female there is low level production of estrogen, and it is a main cause due to this due to it is a main cause of this disease. So what are the symptoms? That is vagina become very dry, and it leads to the discomfort during intercourse. And it you can say that without adequate amount of estrogen in the vagina, the walls thin out and lose their elasticity. So now the vagina not as much flexible as it was previous or as it was before the menopause condition. And discharge, it becomes watery and sticky and yellow in color. And even the vaginal bleeding, discharge, itching, burning, irritation, and painful intercourse may also occur due to this disease. And what are the treatment is mainly there is one very effective treatment, that is hormone replacement therapy, that is estrogen replacement therapy, because due to menopause estrogen level becomes down. So in this condition, what doctors do, they basically inject estrogen inside the female a female healthy body. And due to the and they it leads to the increasement in the estrogen, and due to which this disease after some time goes down, or after some time disappear. Next is strep vaginitis. Strep vaginitis means the swelling of the vagina due to another kind of microorganism group, that is streptococcus. So basically streptococcus sometimes do cause vaginitis. Three kinds of streptococci which is very very effective, very very dangerous for the vagina, that is group A, group B, and group D. Group D is enormously dangerous for the vagina. And it can usually after use of antibiotic, what happens basically, we use different type of antibiotics to get rid of our vaginal like vaginal disease or vaginal infectious particle. So due to this antibiotic, some another type of bacteria become resistant to that antibiotic, which leads to the flourishing of that type of bacteria which is resistant to that antibiotic. So it leads to different kind of vaginal symptoms, vaginal disease. So one cause of group D, strep vaginitis, for example, is the use of clindamycin to treat bacterial vaginosis. So what is here basically, many females, what they do, they wants to they wants to escape the disease, that is bacterial vaginosis, and for that they use a drug, that is clindamycin. But what happens, due to the clindamycin overdose, different kind of bacteria flourish in that vagina, that is streptococcus, and they become resistant to clindamycin, and they leads to another kind of disease, that is streptovaginitis. So what are the symptoms for streptovaginitis? These are vulvovaginal irritations and the discharge. And even the diagnostics tests are usually done for the streptovaginitis, that is an elevated pH we can measure. And a wet prep test is also done to treat the, or we can say to diagnose the streptovaginitis, which shows numerous white blood cells and no lactobacillus, because lactobacillus, if there is a more number of lactobacillus, then it indicate a good or healthy vagina. And if the lactobacillus lactobacillus count down, then then we can say that there is some disease related to related to vagina. So the lactobacilli have been replaced by many small round bacteria which is known as cocci, and a culture will identify group A, group B and group D strep in large numbers. This process is called superinfection. If all kind of streptococcus bacteria are habitat inside the vagina, that it leads to superinfection. And what are the treatment? Basically this infection must be treated with antibiotic, that is amoxicillin 500 mg 3 times a day for a full 10 days. So it is a treatment for streptococcus vaginatis or strep vaginatis. So it was all about the diseases related to vagina. So in the next video I'll tell you about the habits for vaginal good health. So wait for that video. I hope this video will helpful for you. So please support me. If you are think that it is a good content, then please support me. Okay, thank you friends.